Welcome, Old Mom Sunday night. You never know what's going to be happening in Eastern North Carolina. 10 inches of snow, which is epic. I was just telling our guest, my house has been full of teenagers cooking lamb, and my husband is making a hot dog. So there's a wide variety of activity in this household. Um, really glad everybody's here tonight. You're not here yet. You're tuning in. I have a great guest, and we're going to be talking about the flu and why we, including myself, should vaccinate for the flu. And I just want to hear about flu and vaccines because I've found that I have a lot of questions, and I'm a doctor on television. This session was developed by Vindico Medical Education with an educational grant support from Seqirus USA. And you'll see more on the about the project in the comments. But we've got a special guest, Dr. John Russell. Welcome.
Dr. Wood, thank you so much for having me here tonight.
Well, please introduce yourself to us. You were just telling me a little bit.
So I'm John Russell. I am an academic family physician in the Philadelphia area. My academic appointment, I'm a clinical professor at Thomas Jefferson University in Philadelphia, and I run medical education at a large Jefferson hospital right outside the city. And I've been training young people to be family physicians for about 35 years.
Well, and so yesterday, my husband hasn't been feeling well, and he called his family physician. It was in the snow, and the family physician said, "Meet me at the back door." Opened it up, took him in there. Is that a common thing for family physicians to do that kind of thing?
I'm an old guy, and I certainly was drawn to that Rockwellian. I have the picture of the kid getting a shot in my office, behind my desk. So it's always what I ascribe to. But part of that is taking care of families, and things aren't necessarily banker's hours. I've been working in the hospital all weekend. I was in the office yesterday morning. And, sometimes you have to meet people where they're at.
Yeah. Well, it was really nice. It makes you think, wow, people are in this because they care about other people.
But I've had patients I've had since I had hair, right? And, it's...
That was not long ago.
Yeah, it's been a long time. But, these are people that I've known a long, long time. And certainly these are people I care about and care about me. And I know their journey and they know my journey. So certainly I only want the best and whatever it takes to make that happen.
Well, let's pretend tonight that you're my doctor, and I've got some flu questions. So yesterday when I took Thomas to the office, I thought to myself, what if he has the flu? We did not get the flu shot this year. The children got the flu shot, but we did not. Why should I get it?
Yeah. So, I think just globally, it's a great way to kind of keep yourself healthy, keep yourself out of the doctor's office, keep yourself out of the hospital, keep yourself out of the ICU. If you look just in context and taking the COVID year 2020 out, over the last 15 years, we've had between 12,000 and 55,000 Americans die of influenza each year. And just for context, about 5,000 people die of asthma. So, it's a considerable burden on people, and not everyone ends up in the hospital, not everyone ends up dying, but you could really be horribly, horribly sick. And most of us don't live in vacuums, and we might have younger children, we might have older parents, we might have other people, grandparents, people we love, that we might not get super sick, but we might transmit it to someone else who's really sick. So to me, it's kind of like being a good citizen. It's like shoveling your walk, right? So, shoveling your walk is just being a good citizen in your neighborhood.
Right. I think what happened to me, now this is not an excuse, but maybe it is when we had the whole COVID thing happening and we were excited to get vaccinated. Everybody was waiting to get vaccinated. It was like I have this vaccine fatigue, where before I was really on to the flu shot. So is that typical? Are you hearing that from people?
I think we all have vaccine fatigue. I, as a clinician, as someone who's a vaccinologist, have vaccine fatigue. And but partly, if we kind of think back 100 years ago, the average American lived to be 47. 1 in 4 children did not make it to the age of 4. So I think we're hearing lots of narratives about stuff, but they are just kind of real facts about things. And we have eliminated kind of things during you and I's lifetime. Smallpox disappeared in 1977, killed
Right.
1 out of 3 people who had smallpox. So, we're probably not too far away from removing polio from the planet, right?
Wow.
And so part of this is just kind of keeping yourself healthy, right? And
Right.
prevention really being worth the pound of cure. But the CDC kind of reports over the last 50 years we've probably saved 150 million lives on the planet through vaccines.
Wow. So is the flu vaccine fairly safe? Is there anything I need to be worried
It,
about?
you know, it is. So the flu vaccine's a killed virus. So there are
Okay.
live viruses. The MMR vaccine is a live virus. The chickenpox is a live virus. So in theory, you could acquire those diseases from those vaccines. It really doesn't happen. But the flu is a dead virus. They've kind of beaten that really down. People can feel a little bit achy when they get the flu vaccine. It doesn't mean they have the flu. It just
Right.
is a little bit of the reaction from the vaccine. You talked about the COVID vaccine. People felt a little achy. It didn't mean they have COVID. If I get a
Right.
tetanus shot in my arm is sore, I don't have tetanus. It's a little bit of the side effect of the vaccine. But it's a safe vaccine. And in 1976, with the swine flu, that particular vaccine had a little bit more hiccups safety wise than some of the other vaccines, but it's a perfectly safe vaccine that I've gotten for 40 some years, that my family all gets and things like that. And certainly the people I love, because, I've seen people die of influenza.
Right.
So, part of that is, not wanting people to be in that thing. When the country of New Zealand, which has a really robust national healthcare system, even when the vaccine is not perfectly effective, and our vaccine this year is about 70-75% effective in kids, it's about 40% effective in adults. But what New Zealand found, it's still 80 some percent effective in keeping people out of ICUs. And that's what we really want, right? It's not, do you
Right.
get sick? It's, do you get really sick?
Right. Well, in our little town, before it was right around before Christmas, I heard through the grapevine that there were no beds left.
Yeah.
And then you are concerned. Somebody just in here said you're your brother's keeper, but what if somebody else needs care for something else, and that could have been eliminated?
And freedom and some choice is a good thing too, right? So,
Yeah.
part of things is kind of learning about things, and and getting some information that's not a 5-second bite on social media or something like that, and being an informed consumer. Just like if we're getting our car worked on, or we're meeting with our banker or something like that, we want to be informed as we can about things that we put in our body, and there's nothing wrong with that.
Right.
It's just, sometimes we need to just kind of make sure what we're distilling our information from.
Right. Are there any new flu vaccine recommendations this year?
Yeah, so there's a bunch of different flu vaccines. There's a nasal flu vaccine that's been around for a while, that you can get from the age of 2 to 49, and new for this year.
I forgot about that one.
Yeah, people could pick it up at the drugstore and administer to themselves at home if they wanted. So that's really the only new recommendation. But that said, the flu vaccine itself changes every year, because the flu changes. It has small little twists and turns and mutations. So somewhere around February, they're deciding what's going to be in the flu vaccine for next September. So they're looking what's happening in the southern hemisphere, and they're deciding on what species are going to go in the flu vaccine. So it is new every year, and that's why you can't get it every 10 years like a tetanus shot.
Right. So it's February. Is today February 1st ish?
It is. It is.
February 1st. Should I get the flu shot, or is it too late for me for this
Well,
year?
it kind of depends, and if you would talk to the CDC folks, they'd really kind of say you've got another 1 to 2 months potentially to get it. We have a sense of it's come through our community. But interestingly enough, the vast majority of flu vaccine that's given in the United States is given by Thanksgiving. But over the last 35 years, February has had more flu activity than any other individual month. So February is a month that is ripe for flu vaccine. Now, if you were to get it Monday. You were going to get it tomorrow. It's about 2 weeks before it kicks in. So you'll be to
I was about to
Valentine's
ask
Day.
that.
But
2 weeks. Okay.
yeah, but maybe you don't want to lose your Valentine's Day plans, right?
No, and I actually have good plans for
There you
Valentine's.
go.
I bought a dinner at our church auction.
There you go. So you
And so
don't want to
that'll
give
be
up.
fun.
You know, flu vaccine can keep sweet kisses in your life. So that's always a good thing.
Now, a good friend of mine, I was telling her, that was like, oh, you need to tune in. And she was like, well, I had the flu in November, so I don't need the flu shot. And I was like, okay, well, that's the question I want to ask. What if you already had the flu
Yeah.
late fall? Do you get the flu shot?
But the flu season can have several different strains on it. And often you might get a B strain early in the season. And if you got a B strain, you're protected against that B strain. But if there's an A strain, an AH3N2 that comes later in the season, you're not protected for that. So just having flu early in the season doesn't protect you from a different strain later in the season. That's why there's 3 strains in the flu vaccine to kind of have some approximation of the breadth of things that we're going to encounter through that 5-6 month period.
So so there are 3 strains this year, right?
Mhm.
How come some years, I think there were 4 strains
There
2
were
years
4
ago,
strains.
right?
Yeah. So historically, we had 3 strains in the flu. There were 2 A's, an H3N2, an
Uh-huh.
H1N1, and H1N1 is what caused the pandemic in 1918, 1919, and then a B strain.
Right.
And over the last 35 years, it's been one of 2 B strains. It's been Victoria or Yamagata. And about 10 years ago, they said, you know what? Let's put both Bs in, because they were guessing wrong about 50% of the time.
Right.
And B strains kind of impact our kids more. About 2/3 of the deaths in the country in children are from B strains. So they put both Bs in it. And so then it was a 4 strain. It was a quadrivalent vaccine. And one of the things that happened during COVID, one of the strains, Yamagata, disappeared as we all stayed away from each other and wore masks and did all that for a year. That particular B strain disappeared. So the vaccine manufacturers and the people who recommend to the vaccine manufacturers says doesn't make sense to put a strain in the vaccine that's disappeared. So we're back to a trivalent vaccine. So you're not getting cheated if you're getting a 3 strain and you said I used to get a 4 strain. It's just and this all changes. And I think that's one of the things is we have to be nimble in medicine, and we have to kind of react to what's going on.
Does it matter what flu vaccine you get according to what age you are? So if you're 75 or you're 40 or 5?
Yeah, there's something called immunosenescence, and that the older we get, kind of the less robust our immune system is. So for patients over the age of 65, there are 3 designated vaccines that are a little stronger, because they're not going to respond quite so well. If you look at our adolescents, they're going to respond really well to a vaccine. So the vaccines for seniors have a little bit more stuff in them, just to kind of get that immune system. But there's some subtleties, and there are kind of standard vaccines that you and I might get that are going to have 3 strains. They're going to be for people up to the age of 65. There's the nasal flu vaccine that we talked about, which is more or less a standard vaccine. All of them are derived from eggs. Okay. And then there's 2 vaccines that are non-egg derived. So if someone had a really severe egg allergy, someone got short of breath, dropped their blood pressure, there's some things available. And then there are some vaccines that are available for seniors. So partly it's, kind of who you are and, what particular you're going to need. One of the newer recommendations that happened 2 years ago is anyone who's had an organ transplant who's under the age of 65 should get one of the souped up 65, just because their immune system doesn't work so well, because we're giving them all those drugs to kind of protect the organ that's been transplanted into them.
So this is a total aside, but I have an autoimmune disease, and I do IVIG every month. So should I get a souped up version?
The recommendations aren't for you at that
Okay.
point.
Oh, that's good.
With your autoimmune disease, you might talk with your clinician who's part of that to say, what
Okay.
would be the best timing with my IVIG? Should I get it right before? Should I get it a little bit after? But you especially, if your immune system is turned down
Right.
5%, 10%, you just want to be protected.
Yes, yes, I do. Where is the best place to get a flu vaccine? I think sometimes I'm like, oh, I'm gonna have to make an
I,
appointment.
I,
It's gonna
I,
take forever,
I,
and
I
then
think
I don't get it.
I think wherever you can get one. So, getting it from the place where you get primary care,
Okay.
sometimes is good because they have it in the records and they might know some of the subtleties about what's going on with you that might not be known at the drugstore. But the drugstore is fine as well. And depending on your state, one of the good things that's happened in the last few years is a lot of these state registries can kind of help funnel your vaccine information to your primary care office. So I think just getting one, um, I think it just protects you. Um, and, we can only do so much, and fate, can catch us all for all kinds of different things. And if we can protect ourselves, I'm not planning on getting a car accident, but I still wear my seatbelt.
Right.
So part of this is just, kind of best thing. It's putting on sunscreen. There's all these little safety things that we do, right? Cooking our chicken enough, and all these
Mhm.
things that we want to do because we want to be safer. And this is just kind of one of those things that we do as we get older. And the flu vaccine's indicated for everyone over 6 months of age. So really, it's pretty much the population.
Right. Well, and I think you're really make us think about, and there have been a few comments of who you're around, and I love to go visit a neighbor that's older, and I would just hate to unknowingly take
Yeah.
something like that to somebody.
Yeah. And
And
and I think that's really hard and heartbreaking, right? To know
Mhm.
that you kind of transmitted something to someone else. Um, you know, I work in healthcare. I'm taking care of other people's parents, other people's children. I have
Right.
kind of a responsibility, regardless of what I want for myself, to kind of protect these people I'm taking care of, whose immune system they might not be able to protect themselves, or for some reason they can't get the vaccine.
Right.
So I think that's part. But if you think of places like nursing homes and things like that, the flu can sweep through a nursing home really, really quickly. And certainly we're kind of worried about that population that's kind of 50, 60 people that are all sitting inside the same building,
Hmm.
and can be pretty bad for them. And if you look, when the flu hits town, there are more deaths from heart attacks and strokes and congestive heart failure, all these other diseases that cause us to die happen more commonly when the flu hits town, because it's a huge strain on an older system. And the 30-year-old who gets flu, it's going to miss a couple days of work and be on their back and be pretty grumpy, but probably not dying.
Right.
But that 80-year-old might.
Right. Well, and if you're the 30-year-old or the 50-year-old, not that I'm telling my age, and I get sick, it's bad times around here. I mean,
Yeah.
it things do not go well at all. I My husband was sick earlier this week, and I ended up out doing something, and I said, "You know what? I'm not going to be back till after dinner." And he was better, and he was like, "What should I feed the children?" I was like, "You have had these children for 20 years and you're asking me what to feed them. What if I were sick for days?
Yeah.
This would be terrible."
Yeah. And one of my good friends who's a family doctor had her 9-year-old get horribly sick with
Oh,
influenza, a really robust, healthy kid who ended down at one of our children's hospitals. So you don't know what's going to happen, and you don't know who that kind of spinning wheel is going to kind of fall upon.
right.
So it is just kind of one of these things, and certainly appreciate with people having reticence about stuff, right? And there's a lot of kind of information out there that kind of scares us, and we're
Right.
worried about what we put in our body. But hopefully you have someone in your medical life who can kind of help answer some of these questions for you.
Right. And we have one question. Well, we have
Sure.
lots, but there's one I think that's kind of interesting. Can our immune system get lazy having so many flu vaccines over the years?
It really doesn't. It
Okay.
you know the one of the things that's kind of hygiene hypothesis. So
Okay.
if you look at our grandparents, our great grandparents, they lived in drafty houses and they had lots of kids and they had measles and tapeworm and all that. And things were different. There was a lot less asthma and there was a lot less autoimmune diseases and things like that because the immune system had so much to do. But there's never a sign that someone later in life is going to have less of an immune system because they've been protected. And I mean, hopefully that helps people get to that later part of life.
Right.
And, myself, just as a patient, had pneumonia last year, was horribly, horribly, horribly sick, and kind of felt helpless. Right, I'm supposed to know enough to be able to protect myself against all of these things, but you know, there's a bill that we're all going to pay at one point in our life, and
Mhm.
we just don't want to do it any sooner than we have to.
Right. Right. And I had one more question. What was it? Oh, somebody just asked it in here. Oh, is the nasal spray vaccine, what's the effectiveness difference? Is there one between the nasal spray and the shot?
It's roughly about the same. So that's
Okay.
indicated for people between 2 and 49, 2 and 50. That
Okay.
one is live. So the nasal flu vaccine is live. So in theory, and more in theory than in reality, someone could potentially get the flu from that because that is a live product. And it's something we don't want to give people at this point who have kind of asthma and it can irritate, but even that is probably an overblown thing. But for people who don't like shots and people who want to go to the drugstore and kind of give it themselves at home, that is something in the new recommendations.
I remember before I let you go, I had my first three children were pretty close in age, and we went to the health department back in the day to get our shots. There were great
Hmm.
nurses there, and
Sure.
my oldest son got his shot first, and he was maybe 3, and then the 2-year old was watching him, and the 3-year old started howling, and the 2-year old took off out, ran out the door, down the hall. I mean, he was gone. Anyway, it was really
mean, it,
a
I mean,
funny,
I mean,
funny flu shot
I mean,
experience.
and kids get a lot more shots. When I started in medicine in 1990, it was somewhere around 14 shots between birth and prom night, and we are up around 60. But a lot of the diseases that existed in 1990 have really disappeared. And,
Right.
I'm old enough that I've seen a lot of these diseases live. And it's kind of really wonderful when these things have disappeared because of that, and part of that is, kids have really robust immune systems, and the truth is, if something affects 50 kids in the United States, is it worth vaccinating 4 million kids for? Well, ask one of the parents of one of those 50 kids who die. They're going to say, 100%. And I mean, a
Right.
lot of the things that we vaccinate against aren't really impact causing hundreds of thousands of deaths. It's small amounts of deaths, but it's significant to
Mhm.
those parents and to those communities. And so partly it's just, being an informed consumer and probably not being someone who is so kind of reactionary to everything you see, and read a little bit and ask some questions. And probably it's not a decision you have to make in that moment anyway, right? You
Right.
probably have a little bit of time with most of this stuff to think about it.
Right. Well, I think you've convinced me. I'm gonna go and get my flu shot because I
There you
don't want
go.
to miss my Valentine's Day fun.
There you go. There you
Well,
go.
thank you so much for joining me tonight. Sunday night is kind of an off time, but I think lots of folks are just sitting around looking at
I'm
this cold weather, thinking, "Are my children ever going to go back to school?"
honored to spend some time with your audience. So
Thank you.
take,
And
take
this recording is going to be on Vindico Medical's Education Facebook and YouTube and Instagram. And I hope I get to chat with you again.
love to be back. Dr. Wood, have a good
Okay.
night. Take care. God
Thank you,
bless.
Dr. Russell.
Bye bye.
Goodbye.